everyone. Thank you for registering Transform Your Thyroid Health Naturally with Naturopathic Solution webinar. My name is Gayatri and I am pleased to introduce our esteemed guest, Dr. Prerna Goyal. Dr. Prerna Goyal is an experienced specialist in naturopathy at Vadodara, Gujarat, with extensive experience in patient care, delivering trial naturopathic treatments, counseling the patient and preventive care, and pursuing positive lifestyle changes. Naturopathy, an ancient healing practice, is the focus of our discussion today. It helps the body heal naturally, promoting balance and healthy lifestyle. Transform your thyroid health naturally with naturopathic solution hosted by AlterNATIVE.HEALTH. We are thrilled to have Dr. Prerna Goyal here to share her expertise with us. We believe this section will provide valuable insight to managing thyroid health naturopathic strategies. AlterNATIVE.HEALTH is the first telemedicine portal dedicated to complementary and alternative medicines. With more than 38% of US, over 50% of people around the world using these alternative therapies. AlterNATIVE.HEALTH is the only portal which provides all the alternative therapies in one platform. In this session, we'll learn about naturopathy medicine and ancient practice promoting holistic wellness with natural remedies. Without further ado, I would like to invite Dr. Prerna Goyal to present today's session, Transform Your Thyroid Health Naturally with Naturopathic Solutions. Over to you, Doctor.
Okay, so we'll start with the presentation. Can I have that screen?
Okay, Doctor.
Okay, so in this webinar, you will learn how you can heal your thyroid through naturopathy. So we'll learn in this webinar how you can transform your thyroid health with naturopathy. Now, coming to the objectives through this, the last slide, yeah. So coming to the objectives, in this webinar, you will learn what is hypothyroid, how it develops, what are the signs and symptoms of hypothyroid, what are the conventional treatments. You will look at some blood reports, as well as what you will get to know what is the root cause of hypothyroid, what are the naturopathy treatments which you can give, and you will look at one case study. Okay, now coming to what is thyroid. So thyroid disease, it's very common. About 20% people have abnormal thyroid function test, and your thyroid gland, it is present in your neck and it releases hormones. So when your thyroid gland doesn't release hormones, it is called as hypothyroid. And when your thyroid gland releases too much of this hormone, that is called as hyperthyroid. Next slide. Now coming to how your thyroid hormone releases, what is the synthesis of this thyroid hormone? So that is your hypothalamus. Hypothalamus is nothing but your brain, and pituitary is there, and then your thyroid gland is there. So think of your hypothalamus as your boss, think of your pituitary gland as your manager, and think of your thyroid gland as an employee. So whenever in our body, if our boss senses that we have less of thyroid hormones, our boss will tell the manager to tell the employee to produce hormones. So our boss will release TRH, that is tyrotrophin releasing hormone, and it will tell the pituitary, and then pituitary will release TSH, that is thyroid stimulating hormone, and it will tell the thyroid gland to produce hormone. So thyroid gland will produce T4. Then this T4 is either converted into T3 or it's converted to RT3. Ideally, we want that this T4 be converted into T3 and not RT3. But in hypothyroid, what happens that this T4 is converted into reverse T3. Reverse T3. Now, next slide. Now this, like I said, this pituitary gland releases TSH and it goes to the thyroid gland, and your thyroid gland produces T4. Now, your thyroid gland produces about 90% of T4 and only 10% of T3. But we require this T3 because T3 is the active form and T4 is the inactive form. So this T4 is converted into T3 by your gut and by your liver. So if you have any problems with the gut, so for example, if you have gut inflammation or if you have gut dysbiosis means that you have more of bad bacteria and less of good bacteria. So this conversion won't take place. And same goes with liver. If you have fatty liver, or if you have inflammation in the liver, or if you have sluggish liver, this conversion won't take place, and that will increase the level of T3, but T4, sorry, but it will decrease the level of T3. Next slide. Now, what is this function of thyroid hormones? Why do you require thyroid hormones? First is that it controls your metabolism, how fast or how slow you burn your calories. For example, in hypothyroid, you've seen people gaining weight, but in hyperthyroid, you lose weight very easily. And it also helps in follicle and embryo development. So if you're pregnant and the baby inside of you needs thyroid hormones, and if he doesn't get thyroid hormone, then there are less chances of pregnancy, and that can cause infertility as well. And it also controls how the body temperature, so it controls how low or how cold the body temperature will be. And it also controls the rate at which foods move. So it in thyroid, everything slows down, so the content of food stays in the intestine and it doesn't digest, and that can cause constipation. And it also controls fetal brain development. Like I said, in pregnancy you require thyroid hormone, so if you don't have enough thyroid hormone, there won't be good fetal brain development. It also controls how fast or how slow your heart beats. Usually in hypothyroid, the heart beats very fast, and many people get anxiety also, and one of the cause of anxiety is hypothyroid. It also controls the sperm and testosterone production. So if you don't have enough hypothyroid, again, it can cause infertility in females as well in males both. Next slide. Now, what are the signs and symptoms of hypothyroid? So first, you will lose a lot of hair on your eyebrows, and you will have enlarged thyroid gland. You will wake up with puffy face in the morning. You will have hair thinning. You will have a lot of hair loss, and you will have dry skin. Constipation is one of them. Infertility, like I told you before, if you don't get enough thyroid hormone, that can cause infertility, and it can cause heavy menstruation as well. It really impacts your periods as well, and you will have cold extremities on your hands and on your legs, and you will gain weight. You will have poor memory. You will have intolerance to cold, and you will feel tired whole day. You will notice that even if you sleep for the whole day, when you wake up, you feel so tired. That's because you have less thyroid hormones. Next slide. Now coming to the blood test, what blood test you need to do for hypothyroid? So you need to do TSH. Like I told you that your pituitary gland releases this TSH, and TSH is most commonly done in for hypothyroid. But what's not commonly done is this total T3, T4 and free T3 and T4. Like I told you, your thyroid gland produces T4, and then this T4 is converted into T3. If your TSH is normal, but if you have low T4 or low T3, that can also cause symptoms. So you need to check for T4 and T3 along with TSH. Also, you check for free T3 and T4, and check for reverse T3. Like I told you that this T4 is converted into T3, but in hypothyroid case, what happens, this T4 gets converted into reverse T3, which we don't want. So when you do this test, you will get to know that if T4 is getting converted into reverse T3 or not. Now, thyroid antibodies. You need to do thyroid antibody test as well. In thyroid antibody test, you can do anti-TPO antibody and anti-thyroglobulin antibody test. Next slide. Now coming to the root cause of hypothyroid. What's the cause of hypothyroid? So first is autoimmune, Hashimoto's. Like I told you, if you have increase in level of antibody, it starts attacking your thyroid gland. And because it starts attacking your thyroid gland, you don't produce enough T4 or T3. Because of that, you get hypothyroid symptoms. Can we have next slide? As you can see, the risk factor could be your diet, could be your lifestyle, what you're doing, or it could be genetics, which leads to antibody formation, that is anti-TP or anti-TG antibody. And if those antibodies are high, even if your TSH is normal, that is called as subclinical hypothyroid. That means that if you continue with your diet and lifestyle which you're doing now, within 5 years you will get diagnosed with hypothyroid, and this is the best stage in which you can treat your hypothyroid. Next slide. Now, why does this Hashimoto occurs? It occurs because of a condition called as leaky gut syndrome. Now, what is leaky gut? So, as you can see on your left side, that the cells are bound together. They are stuck together like this. But because of some reasons like inflammation, infection, or because of your diet, what happens that there is gap between the cells. Because there is gap between the cells, any virus or any bacteria can directly go to the bloodstream, and because it goes to the bloodstream and your body thinks that, oh, I have never seen this before, so it starts attacking it. Because it starts attacking it, you get Hashimoto's, that is autoimmune thyroiditis. And this autoimmune condition, it's 80% common. About, if you have hypothyroid, 80% chances are there that you will have Hashimoto's as well. Can we go back? So that was one of the cause. A second cause is exposure to environmental toxins. So toxins like heavy metals, or it could be plastics. So when we store food in plastics, or when we put hot food in plastics, what happens is that the content from the plastic comes to the food. And when we eat that food, because it contains tiny amount of plastics, what happens is that it stops the thyroid hormone production, and that can also cause hypothyroid. So it's better to store your foods in glass containers or steel containers. Don't ever store your food in plastic containers. As well as heavy metals also cause hypothyroid. Now, food intolerance. So for some people, they could be intolerant to gluten, or they could be intolerant to dairy, or they could be intolerant to soya, which can cause hypothyroid. If they continue eating that, that can also cause hypothyroid. Next is your gut dysbiosis. So gut dysbiosis usually means that there is more of bad bacteria and there is less of good bacteria. So when there is more of bad bacteria, what happens is that because of more bad bacteria, inflammation happens. And next is that T4 to T3 conversion doesn't happen. So you need to heal your gut if you want to cure your hypothyroid. And next is your stress. So if you take a lot of stress, cortisol is a stress hormone. So the level of cortisol increases, and what cortisol does is that this T4 needs to be converted into T3, but instead the T4 gets converted into reverse T3 because of the stress. So you need to, if you have hypothyroid, you need to work on your stress levels as well. Next is nutrient deficiency. If you are deficient in iron, selenium, magnesium, all these nutrients, that can also cause hypothyroid. Because if you have anemia, for example, many people have anemia. Anemia can also cause hypothyroid because your iron is required for the production of T4, the thyroid hormone. Next is inflammation. So inflammation is when there is redness inside your body. Because there is redness and swelling inside your body, this the transport of hormones doesn't happen properly. So the hormones can't go from one place to another because of inflammation. So if you have inflammation, you need to cure your inflammation first. Next slide. Next. Now, sorry, before, back. Yeah. Now coming to factors affecting your thyroid. So if there is not enough production. Next slide. Next. This one. Uh, Previous. Yes. So factors affect. The next slide. Next, factors affecting thyroid. Next slide. Yes, this one. So factors affecting thyroid. So because if you have hypothyroid, usually there is three defects. You either this thyroid gland is not producing T4, or this T4 is not getting in converted into T3, the conversion problem, or if you or you can have sensitivity problem where T3 is not getting inside the cell. So when we take your case history, we see where the problem where the problem is, whether there is problem with the production, conversion, or sensitivity. So for the production of your thyroid T4 and this conversion, you require iron, selenium, zinc, iodine, tyrosine. Tyrosine is a protein, and you require vitamin B, you require vitamin C, vitamin D, and vitamin E. If you are deficient in any of these minerals, this conversion or this thyroid hormone production won't take place. And for the conversion, you require selenium and zinc rich foods. And for the T3 to get inside the cell, you require vitamin A. You need to exercise regularly, as well as you require zinc. Now, this T4 can be converted into reverse T3. And if you take a lot of stress or you follow a low calorie diet, you have a lot of inflammation, you have a lot of toxins, infection, that can cause this T4 to RT3, reverse T3 conversion, which we don't want. Next slide. Now there are previous. Now what is the standard range and optimal range? So usually when you go to a doctor and you get your blood test done, they look at the standard range. For example, for TSH, the standard range is 0.4 to 5.5. But when we look at the optimal range, we can diagnose the disease beforehand, before it begins. So the optimal range of TSH is 0.5 to 2.5. So when you go for the treatment for thyroid, you need to make sure that the TSH comes between 0.5 and to 2.5, not above 2.5. If it's above 2.5, that indicates there is something going on with your thyroid gland, and you need to look into it. And for free T4, for standard range is 6 to 23, but optimal range is 15 to 23. For free T3, it's 3 to 7, but optimal range is 5 to 7. For reverse T3, standard range is 11 to 21. For optimal range is 11 to 18. And for TPO and TG antibodies, it's less than 2. So you need to make sure that these tests are within the optimal range and not the standard range. Next slide. Now, there is one of the most common myths is around cruciferous vegetables. Many people say that you shouldn't eat cruciferous vegetables because they are goitrogen and that they stop the uptake of iodine. But that's not true. You can eat cruciferous vegetables like cabbage, broccoli, cauliflower, as long as you boil them. You need to boil them. So when you boil them, the goitrogen die off. So there is no effect of goitrogen. But if you eat it raw, then it could impact your iodine. But eating cooked is fine. Next slide. Now, what is the diet which you can follow? So you can follow a gluten-free diet. Gluten-free diet means you need to avoid whole wheat, because we have seen with many patients that they have, whenever they eat gluten, that usually causes high levels of antibodies. So we advise patients to eat a gluten-free diet. And instead of gluten, they can take ragi, or they can take any millets instead of gluten. And you can do intermittent fasting as well. So there is a concept of 12 hours intermittent fasting, 14-hour intermittent fasting, in which you don't eat anything. So usually I advise a 12-hour intermittent fasting. In 12-hour intermittent fasting, you can start you can end your dinner by 9 o'clock at night, and then the next day till 9 a.m. morning you shouldn't eat anything. You should be on a complete fast. So that's 12 hours of intermittent fasting, and after that you can eat anything. After that you can break your fast with nuts like almonds and walnuts, and high fiber foods. So high fiber foods is very important. So fiber foods like green leafy vegetables, your cabbage, broccoli, all that contain a lot of fiber. So you should eat a good fiber rich diet. So I've given a sample diet plan. So in breakfast, you can have soaked 5 almonds, 5 walnuts, and you can take a moong dal chilla with coconut chutney. For your lunch, you can have a gluten-free roti, that is jowar roti, dal, bhindi sabzi, and for high tea, you can have roasted makhana. For your dinner, you can have palak paneer and jowar roti. Next slide. So naturopathy treatment, what naturopathy treatments you can do? So mud therapy you can do at home, because this mud is dug 5 feet deep from the ground. So we dig up this mud and we apply it on your skin. What does it do? It decreases inflammation. Like I told you before, that inflammation can cause hypothyroid, but when you apply mud on the area, like on your throat or on your arms, that reduces inflammation. Next is steam and sauna you can do. Steam and sauna, what it does, it produces sweat that causes elimination of toxins from your body. So whatever pesticides or heavy metals you have inside of you, when you go for regular steam and sauna, that comes out. Next slide. And this is one of the treatment which you can do at home. Throat pack, you just need to take a long cotton cloth and you need to dip it in cold water first and then apply it for 1 minute. Then you can dip it in hot water and apply it for 3 minutes. You need to do this action for 15 minutes at least. And this, what it does is it tells the thyroid gland to produce hormones. So in hypothyroid, what happens, it stops producing hormones. But when you apply this pack, the thyroid gland again starts producing hormones. Next slide. Now, what are the yoga you can do? You can do Sarvangasana, Halasana, Ustrasana, Pavan Muktasana, Shishasana. So what these poses, what it does is that it increases the blood circulation to your thyroid. And when it increases the blood circulation, your thyroid, like I said before, that your thyroid gland requires iron. So when the blood circulation increases, your thyroid gland gets oxygen as well as iron, which it needs to produce hormones. Next slide. Now coming to pranayama, what pranayama you can do? You can do Ujjayi pranayama. So Ujjayi pranayama is really good for hypothyroid, as well as Kapalbhati pranayama every day. Next slide. Now we'll look at one of the case study. So Anita, she was a patient of mine, and she's a 40-year-old patient who came with me with lot of weight gain, body pain. She had a muscular as well as joint pain both, and she used to get tired a lot, and she also had a major mood swings and anxiety, and she had poor concentration, and her cholesterol levels were also very high. And your thyroid gland also controls your cholesterol level. So if you have hypothyroid, usually you will get high cholesterol. But to treat high cholesterol, what we do is we normalize your thyroid function. When we normalize your thyroid function, your cholesterol immediately reduces. Next slide. So in history, she was a known case of hypothyroid, and she was on Thyronorm medicine 150 mcg. And she also had hypertension, and she was on hypertensive medicine, atenolol and telmisartan. And when we looked at her family history, so in her family history, it said that her father had diabetes, her mother had hypertension and hypothyroid. So it is genetics. Because of genetics, she got hypothyroid. Next slide. Next. So timeline. So whenever you come to us, we go back to your birth. So from your birth till now, what has happened with you. We take the whole case history. So from your birth, so for her, at 17 years, she used to get recurrent infection. Because of that, she used to take a lot of antibiotics. Because she used to take a lot of antibiotics, that caused her gut dysbiosis. Like I told you, if you have gut dysbiosis, that can cause hypothyroid. And at 22 years, she got diagnosed with hypothyroid. And at 30 years, she got married. And at 34, she gained a lot of weight. And at 35, she had a lot of body aches and body pains. And at 40, she had umbilical hernia because she was so overweight that was stretching her all the organs. That's why she developed umbilical hernia. Now, as you can see, at 17 years, because of recurrent use of antibiotics for her infection, that could have caused her gut dysbiosis, and that could have led to inflammation. That's why she had hypothyroid. So for her, the root cause is inflammation and gut dysbiosis. Next slide. And she enrolled for 6 months into our program. And at the end of 6 months, her cholesterol level reduced. The thyroid medicine she was on, Thyronorm, it reduced from 150 to 50 mcg. She lost about 15 kgs of weight, and she no more had joint pain or muscle pain. And her concentration level was excellent. So what did we do? Next slide. So what did we do for her? So because she was so busy, she was a working woman. So we built a sustainable plan which she can make and easily make in. She can make easily food in about 15 to 20 minutes, and she can follow her diet. So first we fixed her nutritional deficiency. So we saw that she had a lot of magnesium deficiency, she had iron deficiency, she had anemia. So first we fixed her this deficiency. Then she followed an anti-inflammatory protocol. In anti-inflammatory protocol, basically you have to remove all the processed oil and replace it with cold pressed oil. And so she used to use this refined peanut oil, so we replaced that with cold pressed peanut oil and with ghee. She used to cook all her food, and she used to get quality sleep for recovery, and she used to practice daily pranayama, yoga and meditation. And for naturopathy treatment, we prescribed throat pack at home, which she could easily do at home. And we included healthy fats in her diet. Healthy fats like nuts and seeds, like your almonds, your walnuts, your sunflower seeds, pumpkin seeds, all that we included in her diet. Next slide. Now, another case history. Pooja, a 25-year-old patient, she came to me with Hashimoto's. She had high levels of anti-TPO and anti-TG antibody, and she also had PCOD. She had bacterial infection. She had high levels of cholesterol, irregular periods. She used to miss her periods for 3 months, and after 3 months, she used to get it for 1 month, and again she used to miss it for maybe 3 to 4 months. It used to be gone. Or sometimes she would have very heavy bleeding, or sometimes the bleeding would stop. So she had very irregular periods, and she also had a lot of anxiety. Next slide. Now, when she came to us, she had Hashimoto thyroiditis, and she was already on thyroid medicine, Thyronorm 25 mcg, and she used to also take a medicine for her PCOD, and she was on metformin. Through her family history, we got to know that her father had diabetes, and he also died at 45 because of cardiac arrest, and her mother had hypertension. Next slide. So her Hashimoto's, it could be genetic as well. But at 14 years old, she had tonsillitis. Because of that, she used to get recurrent, her immune system was down. And at 17 years, she had irregular periods. At 20, she started gaining a lot of weight. And at 24, she got married. And at 25, she had a lot of family stress and anxiety going on when she came to me. Next slide. Within 8 months of the program, her TPO thyroglobulin antibodies reduced from 96.3 to 34. Now, what did we do? Next slide. and her cholesterol level reduced. She completely stopped her thyroid medicine. Her thyroid medicine was only 25 mcg, so it was so within 8 months she could completely get off this thyroid medicine because it was such a low dose. And she also lost 10 kgs of weight. And she used to take birth control pills to get regular periods. Now within 8 months into the program, she used to get regular periods without any pills. She used to get it naturally. Because with pills, what it happens is that when you take the pill, you get your periods, but when you stop the pill, you don't get your periods. But for her, she started getting regular periods. And she also had no more anxiety because we taught her some meditation and visualization technique to help her with anxiety. Next slide. Now, what did we do? So first is we cut out dairy and gluten, because as you saw before that she had a high level of antibodies. When you have high level of antibodies, mostly people are intolerant to gluten and dairy. Like I told you, if you are intolerant to any of the food, that can also cause hypothyroid. So for her case, she was intolerant to dairy and gluten. And with dairy, we replaced her milk with coconut milk. And with gluten, we replaced her whole wheat flour with ragi, with jowar, with bajra, with many different types of millets like kodo millet, little millet, all that. And we gave her supplements. So we saw that she was deficient in many of the minerals, like she was deficient in vitamin B12, magnesium, and folate. So the magnesium which we gave her was magnesium citrate, folate, and vitamin B12 to help her with the deficiency. And because she had a lot of anxiety, so we gave her meditation, and she used to practice visualization techniques. And we also noticed in her diet she was very low in protein, so we gave her a protein rich diet. And also we worked on her inflammation, because she had a lot of inflammation. When we detected it, we reduced her inflammation by following the same anti-inflammatory protocol. So we gave her a lot of green leafy vegetables, and we cut down her refined oils to cold pressed oils. Next slide. Thank you. So now I'll answer all your questions.
Any questions or for more information from Dr. Prerna Goyal, you can place your questions or doubts in Q&A section down there.
How is naturopathy different from regular medicine for thyroid problems? So in naturopathy, what we do is we cure your thyroid naturally. We don't prescribe you any medicine, because as long as you take your medicine, your thyroid is under control. But once you go off your medicine, your thyroid goes out of control. But in naturopathy, what we do is, without prescribing you any medicine, without prescribing you anything, we just, with your diet, with your lifestyle, and with your supplements, we change your diet, we change your lifestyle, so that you can heal your hypothyroid naturally without any side effects. But with medicine, usually comes with side effects. What foods and or vitamins can help my thyroid? So for everyone, it's very different what vitamins will help you with your thyroid, because it depends. So if you are deficient in particular mineral or vitamin, we prescribe you supplements accordingly. Usually we don't recommend just taking supplements if you're not deficient in. Can stress make my thyroid worse, and what can I do to feel less stressed? Yes, stress can make your thyroid worse. Like I told you, that T4 can be converted into reverse T3. And when you have high levels of reverse T3, that can cause your hypothyroid. And what you can do to feel less stressed? First is you can do pranayama. In my previous slide, I told you to do Bhastika pranayama, Kapal Bhati. When you do these pranayama, it really helps you calm you down. And also when you have anxiety, it's usually related to hypothyroid. So when you cure your hypothyroid naturally, you will feel less stressed. What are some signs that my thyroid may not be working well, and how can I tell if it's my thyroid or something else? So you will get some symptoms, like in hypothyroid, you will gain a lot of weight unexpectedly, you will have hair loss, you will feel tired all the time, or if you will feel cold a lot of times. So these are some signs that your thyroid is not functioning well. And also you can do lab tests, like you can do TSH, T4, T3, reverse T3, like I told before in my previous slides. Is there any type of exercise that can make my thyroid better? There is no one exercise, but yeah, you can do yoga, you can do walking, you can do jogging, whatever you like. All the exercise are good for thyroid. How soon will I start feeling better if I try natural treatments, and what can speed up the process? So you need to understand, if you are going through the natural route, it takes time. It takes time for you to feel better. Of course, if you come to us within 3 to 4 months, you will feel better. But if you continue the process for at least about 9 to 10 months, you will completely heal your thyroid, and you won't require medicine any longer. Besides food and exercise, what else can I do to help my thyroid? Besides food and exercise, you need to make sure that you're not using any plastics. You need to make sure that you're not using makeup products and all, because makeup products, what they do is they contain toxins and they go inside your body, and that can also disrupt your hormones. For thyroid, which treatment can be preferred for people of all ages? Naturopathy or medicine? Preferably, I prefer naturopathy. Naturopathy does take a little bit of time. It does take about 8 to 9 months, maybe to 1 year, for you to heal, but the healing happens permanently. But with medicine, what happens? You will have to take lifelong medicine. So it's up to you whether you want to take lifelong medicine or whether you want to heal it naturally and permanently. I answered all the questions.
Okay, doctor.
Yeah. Any more questions?
I think we don't have any questions. No. Thank you everyone for joining us today's Transform Your Thyroid Health Naturally with Naturopathic Solutions webinar. We hope that you found this section informative and valuable. We would like to express our sincere gratitude to Dr. Prerna Goyal for sharing her expertise with us. If you have any further questions or would you like to learn more about remedies and alternative medicine, please visit www.alternative.health. You can take consultations with Dr. Prerna Goyal through our portal www.alternative.health. Thank you again for attending and have a great day.